So this is Summer has just joined a private radiology practice. She actually came back from Hong Kong. She came back to Hong Kong following an overseas fellowship. Very well trained in musculoskeletal radiology and MRI, and her radiology practice has a business partnership with GPX and offers $1,000, $2,000 discount off the usual MRI price tag of between $5,000 and $6,000. And GPX bills their patients the published MRI price. Dr. Chan is the MRI expert, and she reports all the MRIs for the practice. She notices that the majority of the MRIs ordered by the GP's practice seem to be quite normal and is worried about the indications. So she feels that many of these may not be necessary and proposes to speak to the GPX managers and doctors. However, the practice manager strongly objects and does not allow her. He warns her that doing so would breach her contract obligations and compromise the business interests of the radiology practice. Mr. Sun is a patient at GPX and has been asked to do an MRI, and GPX will arrange the MRI, ask Sun to pay up front. But he notices that the charges at a clinic near his office are about $1,200 less and requests GPX to give him a referral note to this clinic. They agree, but will charge Sun a referral fee of $1,000. He's very angry, but he feels he has no choice, as GPX is one of the 2 or 3 practices endorsed by his company. So key questions to all the panel, and of course to Clara, who's our radiology expert and was a professor at Hong Kong U. Do you think the RDX and GPX financial arrangements of discount are unethical, illegal, or just business arrangements and patients can choose otherwise, and we have no business to interfere? Number 2, Dr. Chan wishes to discuss the unnecessary use of MRI, and her business manager stops her from doing so. Do you think this is unethical? Does it make good business sense? Should she really talk to the GPs and say this is not really a good use of MRI resources, and probably it's not beneficial for the patient? And the final question is, should GPX charge a referral fee? Do you think this is prudent business practice to cultivate good networks? Is it unnecessary and unfair? And what is the rational basis upon which GPX can actually charge a referral fee? Okay, open questions to the panel.
Okay, you put me in a very tight position. Okay, what's the first question?
First question is, what are the financial arrangement between the radiology practice and the general practice? So what they are doing is that the GP's practice charges the patients the same published price, and the radiology gives them a discount, and they pocket the discount. Do you think this business is ethical? I'm sorry I put you in a position because Clara has a private radiology practice, so and I'm so delighted she's brave enough to come. So congratulations and thanks.
No. I think as a business practice, one can expect an arrangement. Usually, like the practices would collate all the reports. We send to them. They collect the money, and at the end of the month, we bill them. And I believe a discount for that is appropriate. It has to be a small proportion. But the discounts that are being given is just unwritten. It's unwritten. I think the medical council knows about it, but I don't think it's been brought to, has been discussed. It is a done practice, but as I say, it's like any business between 2 companies. If there's a bulk of patients going through, and if the company A that refers to company B bills the patients, collects the films, and goes back to the patient, goes back to them, and they explain everything to them, a discount given to them I think it's reasonable, and it's not illegal. I think it should be only a small proportion. So that's my answer to that question. But the problem is that is the amount that's been asked, that's been expected.
Right. Why does the amount become an issue?
Because the discount is just disproportionate to the amount of work that they're doing in assisting, in assisting the practice of, disseminating the information back to the patients, explaining to them, and billing the patients. And we don't have to bill the patients. I think it's unethical because it's tied in with if you don't give the discount, we won't give the business to you. So I think that's unethical. And I think if there's a discount, one should be passed on to the patients, particularly patients who can't afford the high prices of private practice.
So am I clear to understand, before I move on to the other panel members, that this is actually indirectly is a bribe?
Well, I mean, the radiology practice doesn't need to do this, and I have turned people down myself.
Agreed, but because of the disproportionate amount, I mean, if
I
they leverage it...
I do not think it's ethically correct to do that. And number two, to get a referral fee so that your patients can go to another practice.
Yeah, we'll first ask about the financial arrangement. Or any panel members have about number one? Do you think it's acceptable for a discount, a large discount to be given, but that not to be passed on to the patient?
Well, I also work in private. I am the GP, all right? I also have some experience in running an MRI center in a private hospital. I know what the market is like. Before I answer whether this is ethical or not, let me put it back to you. Is adequate disclosure a sufficient thing to get around conflicts of interest in medical context? Say, for example, if I make known to the patient that I will receive discount from that particular center, and the patients know about it, is that ethical? Because this is a disclosure of a financial arrangement with the MRI center.
But people don't, but it's not disclosed. That is not disclosed to patients. Only said, it's not disclosed.
Now, exactly, if we consider this is a conflict of interest, that contravenes the fiduciary duty between a doctor and a patient, and you fail to disclose, then this is obviously unethical. Whether this is legal or not, we have a lot of room for discussion. There have been cases before, and we actually asked for clarification from medical association and respectable bodies, and also from our lawyers to see whether this is considered as a kickback, whatever you like to make the term. But this is definitely unethical if you have a financial arrangement with another institution and that was not made known to the patient. And even worse, if you order that investigation because you know you will have a financial reward, that would put you even a higher ethical risk that you are ordering some unnecessary investigation.
I think you're right. I get the point. It's a very clever arrangement where there's no actual transfer of money.
Yeah.
So you don't have any evidence, but the service is discounted, enabling, so X discounts the service, and the same service is sold by Y at an inflated price. So there is no kickback as such, and that's the difficulty. Actually, the lawyers have said this is, if there's a kickback, this is illegal. And just because you cannot find the kickback, it's considered there's no way of picking the evidence. So maybe CK, you have some view?
I think if the GP is to charge the patient additional fees just for that discount fee, he is not actually having a service for that patient. So he is charging something that is not providing service. So that is unethical, I consider that.
The other side of the argument is that the GP is providing administrative service. He needs to write a form, and he needs to send the patients necessary MRI preparation information, and et cetera, et cetera.
But if this applies to all the investigations he's doing, referring the patients to, say, blood taking or doing a physio, if he's having this practice, charging every single patient, I think it's still fair if that is his practice. But in this particular case, I doubt very much. It's only from that particular radiology service. He's taking the money into his own pocket.
Enders, any view?
So I'm from the academic point of view. As Danny keeps saying that I'm working in the ivory tower. So from the ivory tower point of view, it's totally unethical because especially if you are not disclosing this kind of arrangement to the patient. And I doubt very much if you let the patient know there's this kind of 30% or 20% discount between your clinic and the radiology institute, and if they know that, they will definitely object to it. Why should I pay that extra 20% to you and then get the service? I think it's not ethical from my point of view as a academic. Working in the academic field. But of course, in the real world, this kind of arrangement I know is existing. But I have the concern that if this kind of practice is being extended to other areas, for example, in the future, the pharmacist and the doctor may not be able to distribute dispense medication anymore in the future, and the pharmacies would be the one who dispense medication. What if the doctor lie up with some pharmacy and say that I prescribe the medication to the patient, but they pay in my office, and then they will get the prescription to your pharmacy and collect the medication, and then you give me 20% discount, something like that. So if this keep going on, it's a growing monster in our profession.
Question 2, how about the approach of Dr. Chan, who wants to engage the GPs about the unnecessary use of MRs? If it's coming, it becomes so obvious. I mean, in academic practice, the radiologists will often say, "What's going on? Too many CT scans ordered." Would you?
I'll categorically say it's unethical. I mean, you should, as a radiologist, advise your clinical colleagues on the proper indications. I must say, in my practice, we don't have that kind of problem. I mean, most of my cases are actually all abnormal, very difficult to report, most of them. So I don't have that problem. But I actually see in other practices, as I say, I have turned down services in, unnamed private practices, which I doubt, done correct ethically. So I think categorically, yes, that's not ethical. You should advise them. I often get on the phone to doctors and tell them they don't need an MRI, you just need a plain film or an ultrasound. It's cheaper. Of course, it's detriment to my practice, but it's cheaper and it should be done. So I categorically say, no, that's not correct. It should not be done.
Okay, let's take a vote from the general audience for the last question. Okay, why should GP charge a fee? Is it unfair? Is it acceptable? Green for okay and red for no. Okay, I just saw 1 or 2 greens there. Can you explain why should a GP charge a referral fee? So sorry. So you meant to say it's not okay. Okay, that's good. Okay, any questions from the audience for our panel? Because it's getting late and...
I should just make a point that, if we were to pay a referral fee, which is actually for administration, as I say, they send us bulk and, it's like any business, but that should be disclosed.
That's correct.
That's not disclosed. It's not disclosed.
That's correct. I mean, a reasonable fee,
It should be reasonable.
Yeah.
We shouldn't ask for more. Why should you pay more, because we've got our costs and, we are professional people. But the patients should know that this practice will give a 5%, 10%. I think it's reasonable, 5% for bulk, for dealing with them, giving us the forms, they're dealing with, dishing out reports and making the appointments with us. That's reasonable, but it should be disclosed.
Well, I want to take this opportunity to thank, first of all, the panel, then all of you for staying behind. And I look forward to more engagement and interaction. And trust me, you will inculcate some of these values in your practice. Believe me. You may forget the lectures, but I think these stimulating encounters will change the way you think every time you see patients. And thank you very much for everybody.